Hi, I'm Rachel and I'm here to talk to you about sensory feeding difficulties. Sensory feeding difficulties are when a child might be eating a very limited diet because they have difficulty with how foods smell, look, taste and/or touch. Your child may also be sensitive around the mouth and face area. For example, does your child dislike having their face and hands wiped, or does your baby appear unsettled if you come too close to their face, for example when offering a dummy? So what do we mean by sensory feeding difficulties? Meal times involve all of our senses. You look at food, we like to smell our food, we can often hear food being prepared, and sometimes we have to be comfortable getting messy when eating food. Please see the occupational therapy website for more information about our senses and their roles. It's normal for children to be fussy when eating at some point during their childhood, but there are some key differences between picky eating and restrictive eating. Picky eaters maintain their weight and will usually eat something from each food group. Picky eating can just be personal preference. However, if you are noticing a complete disinterest in eating and weight loss, then a referral to the eating and drinking team may be needed. What do sensory feeding difficulties look like? Sensory feeding difficulties can be characterised in many ways. For example, you may have concerns about your child having sudden and/or significant weight loss. They may be completely disinterested in eating and may not feel hungry. You may notice they have a strong preference for certain smells, textures, temperatures of foods. You may be worried that your child is not getting the vitamins and nutrients they need to grow, and they may like less than 20 to 30 foods. Why do children have these sensory feeding difficulties? There may be different reasons which are contributing to their feeding difficulties. For example, does your child have cardiac or digestive difficulties? Were they born with complex medical needs? Have they got a history of reflux or constipation? Does your child have a diagnosis like autism which may be impacting on their feeding? Do they have or have they ever needed a feeding tube? It may be due to a combination of reasons, and sometimes we are unable to explain why children have these difficulties. It may be possible that your child has associated food with pain or a negative experience, even if it wasn't the direct cause. Your child's difficulties may be long-standing, and this may involve lots of different people supporting in different ways at different times. It is likely that you will be following advice for long periods of time, and often this advice won't change until your child is ready. It is important to recognise the small steps in your child's journey. For example, your child may now like to look at food on your plate or have begun to pick up their own spoon during meal times. It can be frustrating at times when you feel you aren't making as much progress as you would like, but it is common for children to have setbacks. That is just part of their journey. Your child is an individual and will have specific strategies just for them. One strategy that may help your child with sensory feeding difficulties is messy food play. Please see the video on messy food play for details and ideas. We hope this video has helped you to understand a little bit more about what we mean when we say sensory feeding difficulties. You are able to contact the following advice lines for more information.